This is the Gum Guru with Dr. Macon Singletary from North Raleigh Periodontics. This is a show about keeping your teeth and gums healthy and how a healthy smile affects your overall health. Today's episode is called, Has Anyone Told You You Snore? The solution may be easier than you think.
Welcome to the Gum Guru podcast with Dr. Macon Singletary. Thank you so much for joining us today. I'm Jason Kong, and Dr. Singletary, we've got a subject here that I think a lot of people can identify with, and we're going to be talking about snoring. So let's make the connection here. This is a show about periodontics. Why are we talking about snoring?
Well, it's interesting that you asked that, Jason, because if I ask my patients, 75% of them will say they have been told that they snore. It's a pretty prevalent incidence in our patient population, and so the questions it begs to be answered is, what significance does that make in overall health? And it does. I mean, it does affect your ability to repair and fight infection. So obviously the reason why we have this program in our practice is because of me. I woke up about a year ago with this ugly man snoring in my face on my wife's cell phone. So it was pretty telling because I was denying the fact that I snore. So Dan Gordon and I, who's here with me today, and my wife went to a seminar that involves, it was about 18 hours of continuing education on how to treat sleep apnea. And so we've instituted this because of me in our practice. It's pretty telling, particularly if you don't go through normal sleep cycles. It's a repair phase. If you don't do it, you're going to have all sorts of systemic issues that can occur, dementia, cardiovascular issues.
There's a lot of secondhand issues that are also involved. There's something called, secondhand snoring. The bed partner suffers the most because they're kept awake by this. And that's actually how it all started, because most people may not know that Monica's actually the practice manager, so it's sort of like a family affair. And I recall one Monday morning where she looked like she had just not gotten a lot of sleep that night. And then that was one of the things that, brought it in the industry, or what we've called secondhand sleep apnea, is when partner of whoever is suffering from it actually has the raw end of the deal on it.
Yeah, I was going to ask, do you probably almost need to have the partner in there with you when you ask that question? Because people can be pretty defensive when it comes to snoring, yourself included.
Or deny it.
Yeah.
I was denying it.
It took video evidence.
Yeah, and, some of the side effects of not going through normal sleep cycles is that in the afternoon you get this dip, and people are driving and they fall asleep. They don't allow truck drivers to go on the road without doing the sleep study, because it's a significant factor, people falling asleep at the wheel. So it affects relationships, affects people around you. So you should identify it.
All right, so Dan, we asked this question, do you snore? And if someone says yes, what comes next?
Well, it's really kind of interesting. Like, the way I found out about this is about 8 years ago. I don't know if anybody can see this or if this is ever going to be televised or pictures with it, but I'm about 6'6" and 270 pounds. So even though I don't look it, my BMI is over 30, so I technically qualify as obese. And about 8 years ago, when I started falling asleep while driving, because I was a sales rep, I was spending about 8 hours a day in the car, and right, like Dr. Singletary said, right around 2, 3 o'clock in the afternoon, didn't matter how many cups of coffee, my eyelids just kept getting heavier and heavier. And actually, a dentist friend of mine during one of my checkups looked at me and said, we got to get you a sleep test. So when Dr. Singletary came in with similar symptoms, and Monica looking a little bit worse for wear, we started to expand that into our practice. And Dr. Singletary was actually patient zero for the sleep program. So when people say that, if they have trouble sleeping, or the first question is just, give me a little bit more information about that. Do you wake up in the night? Have you ever been out of breath? Do you have, morning headaches? Are you tired? Has anyone noticed you stop breathing? There's a wonderful acronym. It's called the STOP bang. It's if you stop breathing, if you're tired, or if you've been observed to stop breathing, if you have high blood pressure, things like that. Those are all sort of adjunct conditions to having either snoring or sleep apnea. And there really is a differentiation between snoring and sleep apnea. Snoring, by the medical community, is actually considered an aesthetic issue. Like, oh, that's how it looks. Well, it's not how it looks, it's how it sounds, but it's still pretty bad. Whereas obstructive sleep apnea is actually, it's a pathology. It is a medical condition that is caused by the obstruction of soft tissue at the back of your throat that stops you from breathing. And with sleep tests today, which are very, very accurate, especially ones that we have, we use something called the Metabite, which is made by a company called Bravon. It's this wonderful company in Canada. and it's everything is cloud based. So you have sleep physicians that are able to look at it and help you diagnose it and go in and give you better recommendations about how to treat your patients. And everything sort of is based off this score. It's called the AHI score. It stands for the Apnea Hypoxia Index. An apnea is when you have a cessation of breathing for more than 10 seconds. So that's an apneic event. Hypoxia, it depends on which insurance company you're talking to, but hypoxia is basically when you have a 3% drop in blood oxygen levels in about a minute. So when you take those two events and put them together to create a score, you get the AHI score, and that's the number of times in an hour that you have that event, either a 3% drop in blood oxygen or a cessation in breathing of more than 10 seconds. Dr. Singletary, untreated, the first time that he ever took it, his AHI was 44, which means that 44 times an hour, which is 3/4 of the time, 75% of the time, he was either not breathing or he had a reduction in his blood oxygen of more than 3%.
That's scary.
It is scary, especially when, and this is actually an example of the report, it gives us this entire oximetry over the course of the night. He actually spent about 40% of his time below 89% blood oxygen saturation. Now, people that walk into the ED with COVID, they're in the low 90s, high 80s. If you're in an operating room or you're on a table and your blood oxygen level is below 89%, the anesthesiologist is very upset with you, and so is the CRNA. I mean, that's one of those things where it's dangerous. Organ failure starts happening very shortly after that.
So I want to talk more about sleep apnea, and we're talking about the testing here. Is testing the only way to actually determine if someone has sleep apnea?
It's the only way to properly medically diagnose it. Well, snoring is the primary symptom of it. If someone observes you stop breathing, but you have to be able to measure the effort in your chest. You need an effort belt to do that. You also need a pulse oximeter to check the amount of oxygen in your blood to make sure those two correlate. And you also need to be able to measure the flow in addition to your heartbeat, and you need a microphone to record the snoring. Most people, when they need a sleep study, they have to go to a test facility, which in and of itself is a hassle. One, they're booked out because the majority of the population has some problem of sleep. Because when you think about it, you spend almost a third of your life sleeping. So it would make sense that almost a third of your medical necessities would be related around sleep. So getting into a facility is very difficult. It's not your bed. You've got a stranger watching you, and you've got all these wires hooked up to you. So, and it's very problematic, and you have to do it multiple times to get a good reading. With the advancement of technology, cloud computing and everything else, we're able to do take-home tests that allow us to get we can assess the tests when they come in. We cannot diagnose them. We actually have to send them out to be scored by someone who's trained to do that. And then once that's scored, it actually is interpreted by a licensed sleep physician in the state of North Carolina before a diagnosis is given back to us. So that's how the testing works. It's remarkably simple. And at our office, our costs of our tests are actually our costs to the patient. We use it as a screening tool. One of the things I love working about Dr. Singletary with is that our mission at North Raleigh Periodontics is to serve and not be served. We're not looking to get ahead on everybody. We're actually here. Dr. Singletary has been practicing for, he doesn't like to say it, but almost more than 4 decades. And he is genuinely concerned about the health of his patients. And not only that, but there was a recent study, not a study, there was a finding at an ADA meeting that as clinicians, if Dr. Singletary or myself, if we notice somebody with signs of sleep apnea and we don't make an effort to either inform them about it or to treat it, we're liable if something were to happen to them. So that's how important it is that it's addressed.
Dr. Singletary, I want to bring you back in here for a quick bit because it took Monica recording you and getting this test, I think, to maybe kind of hit you over the head with, hey, this is a pretty serious issue here. But I would imagine that the impact and the effects and the toll that this had on your body, it's gradual and it's happening while you're sleeping, so you're not conscious. But once you get that fixed, can you describe maybe what you were experiencing before you knew you were experiencing it? Like, was it just complete fatigue? What were some signs that you look back on now and say, oh yeah, that was a big problem?
The Keurig consumption at North Raleigh Peri was extremely high.
Yeah, it's interesting you say that because I'm generally a healthy person, and I'm a dental phobic. I don't like going to doctors. Sorry about that, guys. And I think I have a lot of energy. One thing I did notice, it was during my sleep, I would wake up and I would think it was just something in the back of my throat, like phlegm or something. I had to clear my throat. One time I remember waking up and I was choking. It was odd. But generally, we homeschooled our kids are out now, but years ago, we'd homeschool. I come home and sort of help take over, but I could not do anything without taking a nap. The kids would all laughed. Dad's going to come home, he's going to take a nap, and then he's going to be back on track. And that was basically it. I generally have a lot of energy, but now I'm bounding. I mean, I feel great. I feel more alert. Even though didn't think I was losing concentration, but maybe mid-afternoon I would have a little bit of a slump. And but now patient asks, "Are you going to retire?" No, I feel great. I'm like the ever-ready battery bunny. I'm going to keep on going as long as the brain and the hands work together, and we're good.
It's actually really incredible. One of the things that is really important when it comes to sleep cycling is hormones. Testosterone in men, estrogen in women, but most of all, cortisol. Cortisol is a stress hormone. So when you're either apneic or snoring or getting very poor sleep, your cortisol levels are very high. And when that happens, you retain fat, your energy levels and everything else are just off. I have pictures of Dr. Singletary from 2 years ago before he started taking his sleep apnea seriously. He was about 20 pounds heavier, a lot heavier in the face. And in all fairness, he is 3 decades older than I am. I'm a very scant 42-year-old, but when I was working with him, the first year I worked with him, I had trouble keeping up with him. I thought this man had boundless energy. I found out his coffee consumption was through the roof, but since he's been wearing his mandibular advancement device and he's had Nightlase, which is another really interesting procedure that we do. I think we're the only ones in the area that do it. He placed first in his age group in a DECA competition that I competed in as well. And this is sad because he beat me by 9 minutes. It's a Spartan DECA competition. I'm sure the listeners out there can look it up, but it's 10 stations, and between each station, whether it's like lunges or rowing or burpees, you have to run a 1/10 of a mile. This man is 30 years older than me. I outweigh him by 100 pounds. Like, that is a factor, but he still beat me by 9 minutes. And the only thing different between before and after was the fact that he had his sleep apnea treated. Not only that, but after we started sleep apnea treatment, very shortly thereafter, we got him in at the local gym, which I had been a member of for a while. And he's been exercising regular. He's been sleeping great. He's been doing everything. He has more energy now. I didn't think it was possible because when I met him, I thought he was the Energizer Bunny. And now he's sort of like the nuclear-powered Energizer Bunny. He just doesn't stop. I don't know how he gets it all.
Well, Dr. Singletary, you're a more humble man than me because I would have introduced Dan as the guy that I beat by 9 minutes in the decathon when I first introduced him. But you kind of led into this a little bit, Dan. But let's get into this discussion of treatment. So we've gone in, we've taken our tests. That it's a lot easier to do now compared to in years past, thanks to technology. We found out that there's an issue here. What's the next step?
Determining the severity of the issue. We had a patient. Most people take anywhere between 3,000 to 6,000 breaths a night when they're sleeping. I had one patient who took 300.
Wow.
He literally took one breath and did not breathe for about anywhere between a minute to a minute and a half, so about 90-second breaks between each single breath. His AHI was over 100 between the desaturations and the apneic events. It was absolutely bonkers. It was morbid sleep apnea. The guy was going to have a stroke.
Yeah, I mean, just try and do that listening to this show. Hold your breath for 60 to 90 seconds at a time. See how long you can do that before you can't do it anymore.
No, and he did it cyclically. I mean,
right.
And he slept for 6 hours, but he didn't actually sleep. So, and I mean, here again, he was hypertensive, morbidly obese. When we have situations like that, we have to get a primary care physician involved in that. Now, those are usually the exceptions and not the rules. Most people snore to some degree. And when it comes to snoring, here again, it's an aesthetic issue. When you're talking about apnea and cessation of breathing and drops in blood oxygen level, an AHI score of 0 to 5 is pretty much considered normal or par for the course, even 12-year-olds. My son, he's 13 years old. He snores. I mean, he's also 13. He sleeps half the day. Like, that's what it is. And that's a positional thing, too. But when you get in the 10 to 15 range, that's considered mild to moderate. And we have two different solutions for that. The first solution that we like to tend to is a minimally invasive procedure we call Nightlase, which we perform with a laser. It's very cool. It's an ND YAG laser. We used basically biostimulation to sort of take care of all the collagen in the back of the throat. And then we use a more intense laser to sort of tighten up and shrink the collagen molecules. If you ever look at collagen underneath a microscope, it looks like a really long chain. When you hit it with a Nd:YAG laser, it compresses, it shrinks. And when you do that, you have to understand the back of the throat, the vast majority of it, like 75% of the soft palate, is comprised of collagen. So when you do that, you shrink the molecules, you open up the walls, the pharyngeal walls in the back of it, and you raise the uvula up. So when you do that, you open up your airway, it decreases upper airway resistance. And with that protocol, it's usually like 3 or 4 office visits, and then you're good for 18 months. So that's what we lean to when we have a mild to moderate case. Generally speaking, if someone has an AHI of 10 or lower or 15 or lower and don't want to do a mandibular advancement device, that's what we do.
So you said usually about 3 to 4 visits. What goes into those visits? Do you have to be sedated? How does that work?
It's remarkably simple, and there's zero discomfort. I was one of the first people that we tried it out on. It was great. We actually had a party yesterday, actually, where we were trying it out on, or not trying out, but we were performing it on some of the family of the staff members for some local dentists in the area, just showing them what we're capable of at the office. It's about a 15 to 20 minute appointment for a Nightlase appointment. You walk in, there's no anesthesia involved. You put on some pretty funky glasses to protect your eyeballs, and then you lean back. Dr. Singletary might tell 2 or 3 really bad jokes over the course of the 15 minutes. But what it is, there's about 12 sites on either side of the palate, so there's 24 sites. Each site gets about 6 pulses of the laser, and for about 6 rounds. We treat the back of the tongue, which also plays into things, and then we treat the floor of the mouth. Whole process takes about 15, 20 minutes for a session, and drive in, drive out. As far as aftercare goes, it's a bottle of water.
Gotcha. So after those 3 or 4 visits, are we done? Is there any ongoing maintenance that needs to be done?
It's remarkably unfair. One of our best patients was a dentist who's retired, and he's about 75 years old. And generally speaking, the older you are, if you've been like a smoker for a long time, or if you've been wearing a CPAP for a long time, the elasticity of the soft tissue of the back of the throat is degraded more severe than it is with like a 23-year-old college student. Dr. Singletary's son, Mitchell, who is 22, he did one treatment, and his oral pharyngeal opening was gigantic and stayed that way for over a year with just one treatment.
Wow.
Well, he has a lot. Collagen is maintained by our sex hormones, so estrogen in women, testosterone in men. So obviously, if you're 18 to 25 years old, you're going to have a lot more than a 75-year-old. That being said, generally speaking, after you have the first session, second session, third session, you might require a 4th one just to get it up to where we want it to be. We don't stop until the process is complete, and there's no additional charges if you need a 4th appointment or a 5th appointment to get you where you need to be. We take care of you. I mean, that's what we're here to do. We're here to serve. But generally speaking, I would say if you're in late to middle age, so the 50 to 60 range, those results are going to last for about 18 months. And at that 18-month mark, you have to come back and we do a touch-up appointment, because the collagen, there's less of the hormones to maintain the collagen, so over time it gradually starts to elongate again. It only takes one appointment to snap it back together, and then you're good for another 18 months. So you don't have to repeat the entire protocol over again. But it is one of those things where you do have to, be mindful of it. And generally speaking, when the results start to wear off is in the 14 to 15 month range. Now that being said, if someone's like on hormone replacement therapy, or if they're an outlier, it could be longer, it could be shorter. But generally speaking, we like to have everybody come back at the 12-month to 15-month mark for a touch-up.
So it seems pretty easy.
It's ridiculously easy.
It's pain-free, other than maybe a bad joke or two. Are there any age restrictions to this?
None at all. In fact, we were talking to one of the laser representatives. There are a lot of pediatric dentists that are bypassing tonsillectomies and doing this treatment to reduce the size of it, because here again, tonsils are 75-80% comprised of collagen. So when there's airway restriction in children, they've been using this technology in California, Florida, Charlotte, places like that, to actually open up the airway on pediatric patients.
Very cool. So I think we've covered everything with Nightlase. Are there any other treatments that are used for sleep apnea?
Well, the gold standard is a CPAP, and that's a continuous positive airway pressure. I'm sure everybody's seen a stand-up comedian. I know I get them all on my Facebook feed, but the Darth Vader mask or the fighter pilot mask that everybody wears, that is the gold standard. But there's something to be said about that, because if I had 100 people in a room and say, hey, you guys have sleep apnea, you guys need a CPAP. Usually it's more guys than girls, but let's just assume it's guys. About 50 of them, about 50% of the people would actually accept treatment and go get a CPAP machine and go through their insurance, the whole 9 yards. If I were to go back 6 months later and check on those 50 individuals out of the 100, only 10 would still be wearing it. So it's effective 99.9% of the time when you use it, but the efficacy rate is 10%. You still have 90% of people who aren't using it. And the reason for that, well, I think for single guys, the reason for it is because no one is ever going to want to date me wearing this on my face. It looks like the alien face hugger from like Alien and Aliens with like Sigourney Weaver's like. So there's that. Number two, there are people out there with latex allergies. That is a big thing. My father, I'm actually, at 6'6" and 270 pounds, I'm the smallest guy in my family. My brother is, 6'9" and 500 pounds. My dad is he was 6'6" and, 400 plus. They both wear CPAP machines and they have strap marks on their face, and my dad's claustrophobic, so he doesn't wear his. Also, there's maintenance with it because there's humidity factors with it. Not only that, the longer you wear it, the worse the condition of the soft tissue in the back of your throat. But here again, because it's this continuous flow of air, it's like this whoosh, the elasticity of the collagen in the back of your throat, your uvula and all that area, it hangs down worse during the day. Which is why Nightlase is really good, because when you open that up, the upper airway resistance, it's not just when you're sleeping, it's all the time. We've had anecdotal reports. We have a friend of the practice who's an OB/GYN who's a competitive cyclist, and he was one of our first patients to get it done, and he dropped something like 3 minutes off of his 10-mile time, which was unheard of after he's been cycling for 30 years, and the only difference was that. So Dr. Singletary, he actually did a mandibular advancement device, and we used two different manufacturers. The first one is called Panthera. They're also based out of Canada, really good people. And they do a 3D printed nylon. It's very low profile. It's really good for people who also grind their teeth. Bruxism is when you grind your teeth, and it causes all sorts of problems with occlusal trauma, recession, things of that nature. But 75% or 80% of people who have bruxism also have some form of sleep apnea. So we do have something that covers both those, because when you wear a mandibular advancement device, it's like having two night guards, one on the upper and one on the lower arch, and they're hinged together, and it's adjustable, so it's very comfortable, but also prevents you from grinding your teeth. So it's sort of killing two birds with one stone. The other company we use is a company called OptiSleep, and this is all done digitally. It's very cool. Dr. Singletary is very kind when he took me on to let me have a technology budget, which I abuse. Abuse is not the right word.
Don't out yourself here on the podcast. It's research, right?
Yeah, it's research related, but we have a CBC machine, which stands for cone beam computerized tomography, which gives us a very detailed three-dimensional X-ray that's all digital. We have a very powerful workstations. We have a Medit i700 intraoral scanner that creates an STL file, which is like a printable file of what your teeth look like and how they are in 3 dimensions. And we have really powerful software where we can merge the two together. And then we send all that information off to a company in Germany, and they 3D print this all out, and they mail it back to us. The only thing we have to really worry about is customs at JFK holding it up. But the turnaround time from the time someone comes in to the time where they have either appliance or a treatment is about 10 days. So it's remarkably effective and very easy to use.
Yeah, it sounds like it would be something very useful, because you were showing me before the show. I mean, it just looks like a small little mouthpiece.
Yeah, it's actually really cool. And here again, I've had this for 8 years, and I'm also a bruxer. But basically, what it does, it uses the maxillary, the upper part of your jaw. It locks in with undercuts, and the same thing on the bottom, and they're hinged together, and it just advances the jaw a little bit forward. And when you do that, you're opening up the airway, you're preventing the soft tissue collapse. You're preventing your tongue from going backwards. I mean, I would demonstrate it for video, but if you lean your head back, it's like that. But if you were to put this on,
can't do it.
Can't do it. So So that's what I show my patients. Like, how does that prevent me from snoring? And that's exactly how it does it. Because if you look at your esophagus and everything else, it's very sinewy. It's almost like an accordion. Once it gets to a certain amount of advancement, it pops open and stays open.
Well, Dr. Singletary, before we head out, we always have an action step for the listeners. What would that be for this episode?
Well, listen to the people in your family or significant others, your bed partner. If they say you're snoring and keeping you awake and you're denying it, you might heed their advice. You might want to get it checked out and get it confirmed. And it's a simple thing to do. And we can evaluate it. It's a simple test. I'm not a sleep facility guy. That's why we got the Brave on at the office. I'm not going to go to a sleep program in a different place. I can't sleep. It's got to be in my own bed. The device itself is real simple to use. So, heed your family members. If somebody says you're doing it, confirm it or get it evaluated.
That's great advice because there's really nothing there to lose. Your health is too important. The risks associated with sleep apnea are far too serious to be ignored. Dr. Singletary, Dan, thank you both for your time and your expertise today. That'll do it for us. We hope you'll join us again next time. Thank you so much for listening to the Gum Guru Podcast.
If you want to know more about Nightlase and oral devices for snoring, or you'd like to schedule an appointment for a sleep study with Dr. Singletary, check out their website at northraleigh.perio.com. If you have other questions you'd like to have answered on the Gum Guru podcast, send them to contact@northraleigh.perio.com.